Good morning. My name is Caroline. I'm a student of Allegheny College of Maryland. Today is January 31st, 2026. I am here today to get a dressing change on a Piccline on my patient who has an order from the doctor to to be changed every 7 days. I'm going to go ahead and introduce myself. I'm going to introduce myself to my patients. After introducing myself, I'm going to provide privacy. I'm going to wash hands. I'm going to get the doctor's order. I'm going to compare with the patient's arm bracelets. After comparing, I'm going to ask the patient the allergy. If she confirm her allergy, I'm going to go ahead and I'm going to go ahead and move on in dressing changing. So I'm going to first get a glove. I'm going to get a disinfectant Clorox wipe where I'll wipe the area, the surface that I'm going to use uh, in order to be able to clean the dressing to avoid infection. So after doing that, I'm going to take off my glove. I'm going to discard the glove. I'm going to wash my hands. After washing my hand, I'm going to sanitize my hand. And then I'm going to go ahead and offer my patient a mask. What When I offer my patient a mask, I'm also going to put a mask on myself. After putting a mask on myself, I'm going to go ahead to do the dressing change. The reason for the mask to avoid talking or the patient talking to contaminate the dressing, avoid infection. So after doing all that, I'm going to go ahead and start doing the dressing change. I'm going to go ahead and sanitize my hand again and then put on a glove. When I put on a glove, I'm gonna I'm gonna get a tape to secure the lower part of the lumen while I'm taking off the tapes. The reason because so that it will not dislodge as I'm taking off the tape. So I'm gonna removing the tape starting from downward to the upper to the exit line, gently, gently, folding it, folding it, folding it until it's completely removed. After removing that, I'm gonna take off uh my glove. After removing that, I'm gonna put on another glove. I'm gonna get a Clorox wipe. I'm gonna use it to open the start lock. Came and then I'll wipe the areas of the start lock. Then I'm gonna get another this thing, another Clorox wipe. I'll be holding the lumen so that it will not dislodge, gently holding it. I also will wipe the other side, removing it. After removing the lumen, and then I'm gonna go ahead and remove my glove. I'm gonna put hand sanitizer. I'm gonna bring my steroid field. I'm gonna put on my glove. I'm going to pick up the glove with my bare hand towards the inner side. After doing that, I'm going to get the closer wipe. I'm going to wipe the circle motion. I'm going to gently take up the upper part of the lumen, and also uh circle motion back and forth. After doing that, I'm gonna let the air dry for 15 seconds. After doing that, I'm gonna after drying for 15 seconds, I'm gonna put the skin protector all around where the Tazodone will go on. All across where the cover is going to go on, I'm going to cover it with skin protector. After doing the skin protector, I'm going to allow it to dry for 15 to 30 seconds. After doing that, and then I'm going to go ahead and put the start lock. After putting the start lock, I'm going to secure it with a click on the side. Came on the other side. After doing that, after securing that, I'm going to go ahead and get my Tagadon. I'm going to use it to cover all the way to the port line. Make sure it covers the exit side of the thing of the lumen. After doing that, I'm going to get I'm going to use the other side of the lumen to secure it on the lower side of the lumen in order to protect the skin. After doing that, I'm going to use the initial. The initial is going to be the patient initial date and the time. And then I'm also going to check for the how many dots that I see on the tape from the last time the lumen was changed, the dressing was changed. If it was 3 dots, I'm going to also document the 3 dots that I saw on it. After documenting it on the initiating it on the tape, I'm going to go ahead and secure and make sure my patient is stable. After doing that, I'm going to go ahead and clean up my areas. After cleaning my area, I'm going to make my patient comfortable. After raising the head of my patient, making sure my patient is comfortable, I'm going to go ahead and leave the site, and that's the end of the dressing change. Thank you so much for